Hi, this is Severin, one of the student nurses. Today, I'm going to complete my practical medication administration and have my MAR here for my patient, Mela Larson. And I'm going to start by completing the medication safety check, making sure I have the right patient, I have the right medication, I have the right dosage, giving it at the right time, the right route, and I will do the right documentation. So I have Mailer's MAR here, and I have her orders over here. Push this a little bit so you can see. All right, so and I have my sharp container. I have my everything here. So I'm gonna do the first check. I have Mela Larson. The first medication I have here for her is Practo haloperidol 2 mg. I have Practo haloperidol 2 mg. Practo haloperidol 2 mg. IM intramuscular. Also, this one says give 2 mg per ml. And the name Mela Larson matches, the date of birth matches, and the container is intact with good expiration date. Okay. The next medication I have here is insulin lispro. I have insulin lispro, and the name Mela Larson, the name matches Mela Larson. It says give subcut with breakfast, and the expiration date is good. The bottle is intact and the vial is intact. The third medicine I have here for her is Ducosset 100 milligram. I have Ducosset 100 milligram. Okay. So 100 milligram per meal to be given 100 milligram per tab to be given orally. So each tab here has 100 milligrams. So she's gonna get one tab. And that is Mela Larson. Mela Larson, Mela, date of birth matches with expiration date. I'm gonna go ahead and complete my second check at this time and pull out the medications. Then we'll go from there. So the first one I have here again is haloperidol 2 mg subcut Mela Larson 2 mg per ml. So I'm gonna draw. I have the right syringe here with that can contain 3 ml of medication. So this one is asking me to draw. Asking me to draw 1 ml. So I'm gonna draw 1 ml of air into the syringe. 1 ml of air. 1 ml of air. It shows 1 ml of air. I'm gonna inject the air right here. Okay. Right. I will draw 1 ml as I hope it shows 1 ml. All right. So for that medication, gonna put it here. All right. So I have haloperidol 2 milligram Mela Larson. The next medication I have here is insulin lispro. It says give 10 units. I have the right syringe for that. Insulin comes in small doses. It says insulin. Insulin Mela Larson, insulin lispro Insulin Lispro, the vial is intact, the expiration date is good, and it said draw 10 units. So I'm gonna get this little syringe that started from 5.5 to 10. I'm gonna draw A. Hopefully it shows. I'm not sure it's gonna show it. Try to make it show. All right. So I'm gonna inject the A into this little thing. The 10 units of A. All right. So I'm gonna draw the same amount into the syringe. Right. I have that. Hopefully it shows. Hopefully it will show that. Yeah. Anyway, I draw 10 units of insulin into the syringe. So I'm gonna go ahead. Have that. Insulin Lispro, Melalazine. The last medication I have here is Ducosat 100 milligram per tab. Ducosat 100 milligram per tab, given orally. I have Melalazine. Date of birth matches. The medication is intact. So I'm gonna go ahead and pull the medication out. Okay, like that. I pull it out. So I'm gonna go ahead and give the medication right now to this patient. I'm gonna go to her room. Pen. All right. Here you go. Hi, Mila. Hi, this is Selvin, one of the students, and I'm here today, Mila, to give you your medication. I would like to identify who you are, to check on you to make sure that I'm giving the right patient the medication. What is your name? Okay, you said Melalazine. The name you gave to me matches. What is your date of birth? Okay. Yeah, the date of birth you gave me. Yeah, it matches with your wristband. Do you have any allergies by chance? All right, thank you. I'm gonna go ahead and pull the curtains for your privacy and get my hands washed. Right, and don my sterile gloves, a little bit small. A little bit small for me. All right, so now we are going to start with your IM injection, the one that will go on your thigh area. So this medication is for your agitation. We are going to give it to you on your thigh. You have already given me your name. So the medication is haloperidol. I have 2 mg per ml. I have the right route, which is gonna be on your vastus lateralis, and I have the right time is given now, and I have the right documentation. I'm gonna do that when I'm done. So I'm gonna go ahead and locate the landmark. So we have your thigh here. Upper here we have your greater trochanter of your femur. Down here we have your knee. Above your knee, come to the mid interior thigh. Your mid interior thigh. We locate your vastus lateralis at this mid. So we are going to go ahead and give you your IM medication here. We are going to clean the area in a circular motion from in out. All right, we're gonna allow to air dry. Then we are going to replace that with the orange. So as I said, we are going to clean here, right? I'm going to use my non-dominant hand to spread the area, okay? And I use that. First of all, I'm going to get that off. Use non-dominant hand to spread the area, okay? Spread it and go at 90 degrees straight. Inject and remove and put away, and put a little gentle pressure on it. All right, so we are going to do your insulin for your blood sugar. I know you have taken your breakfast this morning, so we are going to do your insulin today on your abdomen, getting your adipose tissue. The landmark we're going to do this morning, this is the insulin. The landmark is going to be by your belly button. We are going to go 2 inches away, and we are going to give you the insulin at 45 degrees. And this is the insulin. You have told me who you are, your name and your date of birth, the right medication, the right time is now, the right dose is 10 units, and the right route. So I'm going to go ahead and clean the area 2 inches away from your umbilicus, and that will be here. I'm going to do the cleaning, the circular motion in and out. I'm gonna allow to air dry. I'm gonna replace it with this. So I'm going to do that here. Allow it to air dry. I'm going to pinch. Pull that out. Pinch. And use the hand and go to 45 degrees and inject and pull out. Put away. It's that. And tap. All right. So we are going to go ahead and do your oral medication. We have that one here, and that is for your stool softener. Have you gone to number 2 today? Okay, so this one, you have already told me who you are, your name and your date of birth. So we have 1 tab, and that is 200 milligram, and you're gonna drink it with water, and this is the right time, and I will go ahead and document afterwards. So I have water here, and you have your medication. I can see you already drink the medication. Thank you so much. So Miss Miller, I will give you this call light. If you feel unusual or you feel funny or anyhow that is not familiar with you, press this call light. I will come back and get you and see what is going on, and I'm going to go ahead and reduce your bed for your safety. Thank you so much for letting me use you complete my medication administration. I really appreciate this. Thank you so much. Thank you. All right. I'm going to do my right documentation for the 3 medications. All right.